So here's our overview for the next hour and a half. So we'll do kind of a welcome. We'll welcome our new members especially. And then we're going to do breakouts, kind of hub-based breakouts so that you can have the opportunity to talk with some of your local CHN members and get to know them more. And then I'm really excited for so CHN right now has something called the Catalyst Collective in process, and we have about 19 members who are going through a community organizing training. And a couple of weeks ago, we did kind of a celebration where everybody shared their public narratives or their stories of why we're involved in climate organizing and action. And we're going to get to hear the stories from Ode and Angelina. So that'll be really fun. And then we'll turn it over to our voting for climate and health team to get some updates. And then we're going to hear Wendy Ring, the story of how she came to create a board game, which will be really fun, called the Evergreen Game. Then we'll hear updates from our sustainable energy team. And then we're going to turn our attention to Fresno, which has been a real hotspot for legislative advocacy in the past couple months or so. And we'll hear from one of our members, Ray Svora, about the political challenges in Fresno, in terms of speaking out about climate. And then hopefully a new member, Morgan, will get to share about her first experience doing a legislative office meeting with Assembly Member Costa. We've been trying to get him kind of, voting for climate federally. And then we'll close out. So that's the overview. Now you can go to the next slide. Wonderful. So we always like to orient around our focus and our mission. So Climate Health Now is a group of doctors and health professionals in California who recognize climate change as the public health and equity emergency of our lifetimes. Because of that, we organize and mobilize the trusted voice of health professionals to advocate for a rapid, just transition off fossil fuels towards a healthy, equitable society sustained by renewable energy. That's kind of our pledge of allegiance is our mission. Okay, and then next slide. And we also have some norms that we've all agreed upon. So I'm going to go ahead and just call out one. So these are, kind of the ways that we want to create our culture as a community. And for today, I'm going to just call out the bring humor, because it can be hard to hold on to when things feel so hard, and just, reminding people, reminding each other when there are opportunities to bring humor to this work, to keep the heart in it. So that's it. And then the next slide. So we would love to invite our new members. If this is your first community meeting, or if you joined recently, if you could share your name, your practice or specialty, where you live, and then just one sentence about what called you to join us. And before we start sharing, if anybody doesn't know what hub you're a member of, we have a membership form that helps us to connect you to your local hub. So that's called the membership form. And one of us, maybe Amanda, if you could drop it in the chat, that'd be great. Because that helps us to plug you in. So let's see, any new members want to step up and introduce yourself? Well, even if this is your first meeting. So I think, Diana, is this your first community meeting?
Yes, it is.
All right. Do you want to introduce yourself?
Yeah, so sorry for not being on video. I'm currently delightfully unemployed, starting a new job next week, and I'm still in bed. So
oh, that sounds great.
Oh, yes.
Really.
It's delightful. It's delightful. So I'm a family doctor. I was working for Ravenswood Family Health Center in East Palo Alto, and I live in the East Bay. I will be starting a new job with the County of Santa Cruz next week. And so I will actually be moving to the South Bay, maybe the hills, not really sure. It's kind of a crazy life change. And so a lot of changes will be coming from that. I have a 1-year-old, and he is kind of my reason for waking up to the urgency of the crisis and of the need. I'm also fairly involved in organized medicine, and my hope is to kind of infiltrate organized medicine with a little bit more strategic planning that involves climate action.
Awesome. Happy to collaborate with you on that. Yeah, and if anybody here is part of CMA, I would love for you to let me know, because we're definitely trying to infiltrate to make it more of a social justice oriented organization, which it is, as you know, not yet. So welcome, Diana. Glad you're here. Is this anybody else's first meeting? I don't think so. Okay. And let's see. So we're doing okay on time. To invite is for everybody to join a breakout in your hub. And there's not going to be a lot of people, so this will be a really great way to get to know people close to you. So if Amanda, if you could pop up the breakouts, and the question, we just like you to say hi, check in, and then if anybody's aware of local climate justice efforts, initiatives, campaigns in your city or your county, we'd love you to just share a line or two about things that you know about, and organizations, and then we really want to kind of crowdsource that to see where there's opportunities to partner with local organizations doing the same work. So and we're going to
I can open the room so that there won't be somebody. So I think you guys can you should be able to self-assign. Let's try this. If you can't self-assign, I'll assign you, but I think, okay. Are you guys able to assign yourselves?
Let me see.
I don't.
Oh yeah, it's in the top. It should be the top left. Join breakout room.
Okay.
And so you would just, if you don't know yours, just let us know, and we can it just tell us where you live.
Top left to what? Are you supposed to click on something?
It says join breakout room. It's like 4 little boxes, or it could be on the bottom menu too if you're on your computer.
Yeah, I don't.
It's not there.
Oh, okay.
There, yeah.
Okay, let me try. I can just try assigning people. Let's see how that goes. Okay, I'm gonna just, Trisha, remind me where, I'm just gonna call out names. You're in LA, right? I think Trisha's in LA. Okay, if I assign you to the wrong
Trisha
hub,
is in LA, yes.
yes, okay. Diana, do you wanna go to Peninsula or East Bay?
Oh gosh, I gotta choose.
I'd say go where you're headed would be my.
Yeah, probably Peninsula would be.
Peninsula, okay. Alrighty, Megan, you are Capital
Corridor.
Okay. Okay. Angelina, you are Capital Corridor, right? Okay.
Yes.
Okay. Let's see.
Okay.
Are people, is this working?
This is good. Oh, this is East Bay.
This is still the main room.
This is the main room.
Yeah.
I'm Golden Gate, Amanda.
Yes. Okay. Thank you.
Thank you, Amanda.
Eve, where should Eve, I don't know what hub you are.
Oh, I'm in East Bay.
East Bay. Got it. Okay.
I think I'm in Capital Corridor.
Okay. I think, Wendy, I put you there. Did I?
Put me in Golden Gate.
Oh, I'm sorry. Okay. You're totally right. Okay. Capital Corridor. Gotcha. Okay. Okay.
Let's continue. Okay. Welcome back, everybody. Hope that you got to connect a little bit with some of your local partners. And we'd just like to take a couple minutes if there were any local climate justice campaigns in your area, if you could shout them out, and we'd love to kind of crowdsource those and then follow up with each other. So does anybody want to share any? Brett Walter, we have from Susan.
Oh, that's
I can share from the East Bay Hub one kind of question, like a possible campaign is around, or it is a campaign rather, around expansion of the Oakland airport. And there were questions, I think, of, you know, what are kind of all of the sides to that, and is that the right, you know, what are all of the different facets to that argument?
Got it. Thank you. Any others?
This is Karen Duderstadt, and many of you may know that I working with Alliance of Nurses for Healthy Environments, and I just thought I'd pop up. It was our discussion in the Golden Gate Hub. It was part of planning. So Margie, I hope it's okay that I'm speaking up, but the Alliance of Nurses for Healthy Environments in October is featuring the Children's Environmental Health Month, which is HR 68. It was just passed and signed by the Assembly and recognized by the governor. And that's to feature children's environmental health issues in October in California. So that we're one of the first states to really, you know, step out and do this. So we're having a series of educational press briefings, like 30 minutes with a health expert, a environmental organization person, and elected officials. So we've had two so far. It's been fairly successful. One last brief thing I'll say is that, which I mentioned to Golden Gate Hub, was our first one. We were hoping to have some press, and we had a couple of press committed, was the oil spill. So we had press on there all. Oil spill was incredibly important, and an opportunity for all of us to feature the issues with fossil fuels, but it was quite interesting and successful. So we have another one on Tuesday. That Barb Sattler, who's a well-known nurse environmental advocate, she will be speaking on issues around fossil fuels and climate change, and we have selected officials as well. So just to update you on that. But Golden Gate Hub we're planning, I would say, right, Margie?
Yeah.
Karen,
Cool.
can you share information about that with us? So we could, like, if there's stuff we could share out on Twitter, or just ways to support that.
Yes,
And in our newsletter
totally do that. Yeah.
Okay.
I'll be happy to. I will send you a bunch of stuff on email, Amanda. You can share.
Okay, cool. Are they in person or virtual?
Virtual. Everything's virtual these days.
Everything's virtual. Okay.
Yeah.
And plus,
So,
you know, to get the groups together, I think that's the best format these days.
Yeah. Okay.
So thank you for sharing this. Well, you know, we'd like to keep this conversation going and to continue to learn what you're aware of locally, so that we can try to support and collaborate. But we're going to leave this for now and turn to storytelling. So in community organizing, one of the key leadership practices is telling our stories in a way that invites more and inspires more people to join us in action. So we're going to listen first to Ode's story and then to Angelina's, and these are stories that we've worked really hard on to really craft in a way that lands to, you know, to inspire more people to join our work. So Ode, do you want to go first?
Sure, I can go. Okay. When I was in 6th grade, I took a field trip to UCSF to live a day in the life of a scientist. My class toured the lab of Dr. Shannon, a renowned pediatric oncologist, and learned all about DNA and the quest to understand the genetic mechanisms that give rise to pediatric cancers. For a young, curious lover of nature, the lab felt like a playground, and being a scientist seemed like the best job in the world. I decided that day to become a scientist and to uncover the secret workings of nature in order to help people. 20 years later, I'm a PhD trained biochemist and neuroscientist, and I'm living that dream. I'm the daughter of immigrants from France and Cote d'Ivoire, raised in the United States with a deep and enduring belief in American values and the American dream. This is a land of freedom and opportunity and diversity that welcomed my parents and allowed them to pursue a higher education and provide better opportunities for their children. Education, and especially the lab, was a refuge for me, a place I could honor my parents' generosity and sacrifice and search for answers to my deeply rooted questions about life, the world, and my place within it. I took on one of the most fundamental questions in neuroscience during my PhD: how do organisms consciously sense their environments and internal states? I carefully studied the intricate dance of metabolism and its intersections with the enduring mysteries of our nervous system. Midway through my PhD, I traveled to Cote d'Ivoire to meet my paternal family and connect with my West African roots for the first time. Over the course of a month, I quickly fell into a new way of life, wearing colorful pins during my morning market runs and spending afternoons pounding plantains into fufu with my aunts. A few months prior to arrival, one of my uncles had passed away from malaria. His infection had gone untreated, allowing a secondary infection to take hold in his brain. By the time he was seen by a specialist, he had lost mobility and quickly thereafter fell into a coma and succumbed to his illness. It became evident that his fate was inextricably tied to the social, environmental, and cultural dimensions of his life. From the stagnant mosquito waters in his lived environment to the fatal wait times caused by a shortage of physicians. Upon returning to the US, I found it difficult to reconcile the lessons of my travels with my work in the lab. Research started to lacked a sense of immediacy and started to feel like a promise of a future we already had the tools and resources to provide, the tools and resources that so many communities around the world still don't have access to. I searched for a way to bridge this gap and decided to become a doctor to gain the capacity to translate my understanding of the biomedical sciences into solutions that can more immediately help people. Most of us choose a career in healthcare to help people and reduce suffering in the world. We sacrifice aspects of our youth taking on intensive studies, amass mountains of debt, and shed countless tears in service of a higher calling and purpose. We take an oath to do no harm and leverage our time, intellect, compassion, and power to care for the lives of those in need. The pandemic hit during my first year of med school, and I witnessed how quickly our healthcare systems pivoted to address the novel threat of coronavirus on our communities. Health providers sacrificed their own safety to work at the front lines. Educators worked to create new ways of educating the next generation using digital tools, and scientists acted with warp speed to develop new therapeutics. I also witnessed the failings and limitations of our system, the ways it so often leaves out the poor and vulnerable, the ways our institutions have lost some trust and public health measures have become objects of politics. Today, we are faced with the greatest challenge that humanity has ever encountered. Our planet itself is in need of healing. Our dependence on fossil fuels has polluted the air we breathe, the water we drink, and damaged our fragile ecosystems. Without immediate action and course correction, we face extinction. While our medical training did not exactly prepare us to handle this crisis, we have everything it takes to meet this moment in history. Our deep moral resolve, the trust of our patients, the power, capital, and infrastructures of the institutions we occupy. We are healers. Let's join forces to heal our planet. Join me in the Climate Health Now Catalyst in mobilizing health providers and students around the state to take climate action. This is our lane. This is our time. Let's get to work.
Thanks.
If you want to unmute yourself.
Yay. That was so good.
Yay.
Thank you,
so much.
Ode.
Really powerful. I think we've all kind of through this process really seen how important it is that we craft our message in a way that shows people how to take action and to overcome the powerlessness, which I think you really did. So then we'll turn to Angelina's story.
Hi, I'm Angelina Franzune. I'm an allergist in Yolo County. So as an allergist, I'm an expert in identifying a patient's triggers of their disease. I recommend avoidance when possible, medications when not. In training, it seemed clear cut, but after moving to the Central Valley, I noticed a change. I had to recommend more and more medications to control patient symptoms. Avoidance was nearly impossible as pollen counts were so high and increasing year after year. In the summer of 2020, I was already stressed as a mom of 2 young children dealing with the pandemic, and then the fire started. I remember taking my girls outside in their rain boots to enjoy a rare August thunderstorm, their little squeals of delight, a stark contrast to the weeks to follow. Little did we know that that was the last time we'd see a blue sky or play outside for over a month. The next day, the smoke started billowing in, our nearby beloved Berryessa Hills progressively turning to ash over the course of 6 weeks. Eventually, the fire would burn an area the size of Los Angeles. That month, I watched the farm workers bringing in the harvest under a surreal orange sky. I began instructing my patients on how to construct makeshift air filters out of box fans. I listened to frantic patients gasping on the phone, telling me they couldn't breathe despite taking all their asthma medications correctly. I prescribed the strongest medications just so they could breathe and realized that the problem was not just the disease, but the environment. I had to stop the summer of 2020 from being every summer. That's when I found Climate Health Now and began to tell our elected leaders about my patients' stories. Let me tell you about Carla. I first met her when she was 4 years old. She was gasping for air, congested, sneezing, and itching all over. I had to give her an oral steroid medicine, which can stunt her growth multiple times just so she could breathe. She is allergic to everything and needs 6 different medications year-round to control her symptoms. This past year with video visits, I learned that she lives with her family in a 1-bedroom shack near I-80, the busiest freeway in our area. Her disease is a direct result of her environment. Living close to a source of air pollution, high pollen counts due to increased carbon dioxide in the atmosphere, and poor quality housing unable to shelter her from these daily injuries or from the too frequent wildfire smoke. Remember when we applied to medical school? Our personal statements all contained some version of, I want to help people. We went through years of training to recognize and understand disease and their treatment in order to fulfill that sole purpose of helping others through science. We can prescribe the latest treatments, but medication can't cure climate change. For centuries, physicians have been the champions of public health, advocating for clean water, basic sanitation, vaccines to eradicate smallpox and very nearly polio, and eliminating tobacco smoking from public places. Advocating for a livable planet is the next evolution in our professional journey. In trauma medicine, there's a concept known as the golden hour, a short amount of time where a patient may seem stable as the body can compensate for a severe injury. Once that time is up, chances of recovery become slim. Current evidence shows that urgent action must be taken to avert the worst effects of climate change and preserve a livable planet for our children. We have cataloged the symptoms, came to a diagnosis, identified the triggers, and now it's time to administer the cure. Physician organizations must use their power to demand urgent government action to decrease CO2 emissions and mitigate climate change. I ask that you join forces with your colleagues and demand real, demonstrable change in policy and the use of our medical society's considerable resources to lobby for climate crisis legislation. This is our species' golden hour. We have to act now.
Woohoo! Thank
Bravo.
you. Yay.
Yay.
Thank you,
Excellent.
Angelina.
That's great, thanks.
I think the more that we can kind of really craft our messages, whether we're giving grand rounds or we're talking at a city council, the more we can give people a clear sense of what they can do and how to be involved and really touch emotions in the ways that I think these 2 stories really do. The more we can build our movement. So I really appreciate you both sharing. And I know there's been a ton of work that went into crafting that. So thank you. And then we're gonna turn to Susan Penner, who's here in the East Bay. And you wanted to share an announcement about a cool app.
Yeah, I just want to take a moment. I've posted a couple times in chat and I'll post it again, contact information for Brett Walter. He's produced an app called Climate Action Now, so very close to Climate Health Now. And it's a free app. It's very easy to use. I call it grandchild tested because I don't have to call up a grandson to help me figure out how to load it and use it. And what it does is you very quickly can go to actions. So you can very quickly either call, email, or Twitter your elected representatives or corporations on various actions to support environmental issues. So I really hope people will check this out. He's located here in the Bay Area, and I've heard him speak and lead groups a couple times. I think he'd be a great person to perhaps come and share with us at some point. So again, I'll post one more time in chat so you can get the information on the app yourself. And thanks for your time. I appreciate an opportunity to root for him. Thank you.
Great. Yeah, I had not heard about that before. So we will check it out. And then we're going to turn to our Climate for Health team. So Cynthia and Margie, and we're running a little over. So if you could keep it, to 12 minutes or less, that'd be great. And I can share too. obviously.
Can you share the slides?
Yeah, I'm pulling them up right now.
Thank you.
Yep.
The Voting for Climate and Health team has been working really hard to resuscitate our democracy. And so far, 19 states have enacted 33 laws that make it harder for Americans to vote. Cynthia will be talking later about our Health of Humanity Depends on Healing Democracy work. But right now, we want to talk to you about voting, because voting is a social determinant of health, and who we elect to represent us determines whether we have clean air, water, or access to health care like reproductive rights. It's important that our patients vote. Can you move to the next slide, please? There's a large overlap of our most vulnerable patients and non-voters. You can see this blue circle here is unregistered eligible voters, and this pink circle here is patients who are most marginalized by the healthcare system. And there's a huge overlap of the young, poor, and people of color that are in both of these little circles. Can you advance the slide, please? When our patients vote, campaigns are more likely to address their needs. So people vote, they're labeled as likely voters, campaigns will make contact, and policymakers will make, and legislators will start making efforts to hear what their issues are. So as healthcare providers here in the blue the dark blue, we can help these people, promote them, and encourage them to vote. And so that's what we're going to do. We'd like to start this Get Out the Vote campaign in conjunction with Vote ER. And here's next slide, please. And Amanda, I'll ask you to start this video. There's a video about Vote ER and why they started doing this and how we can get involved. So can you start that video, Amanda?
Ashley's screen sharing. Ashley, can you, or you want me to do it? Ashley.
Okay, thank you.
If you could do the video, because I didn't set up the audio right, Amanda.
Oh, okay.
Sorry.
Yes, give me 1 second. I'm so
Okay.
sorry. Okay, let me just set it up on my end.
Sorry.
Okay.
Amanda's our video guru. I should learn about this.
It should not be.
Vote ER was started by ER doctor Alistair Martin in Boston. And he found that, again, like Angelina, his patients would come in over and over to the ER because that's how they got their care. And one person finally asked, like, why are you wearing this lanyard? So here's the story. We'll watch it.
Okay.
Yeah, I wish I could tell you that was one story about that one time I saw a child mutilated by bullets. Or that time I cared for a family so hungry they came to the emergency department simply for food. Or that one time where I couldn't discharge a child home simply because there was no home for them to go to. See, it's not just one story, and it's just one time. There's just far too many to count.
And COVID-19 is just exposing how broken our healthcare system is. I remember at the beginning of the pandemic, we had patients desperately asking to be tested. My response, I just didn't have any tests to send. I remember one patient asked me, well, doctor, how is that fair? I just saw the entire Brooklyn Nets got tested 2 days ago. I didn't know what to say.
This spring, as the coronavirus pandemic heated up, I began to wonder what would happen with Wisconsin's spring primary. It never occurred to me that our state would actually risk people's health by holding an in-person election during a pandemic, particularly when safer alternatives were available.
COVID-19 has made it harder to vote in safe and healthy ways, particularly in communities of color where we see those most impacted by failed healthcare policy.
And that's not why I went into medicine. That's not why I became a pediatrician. I didn't do this to experience countless stories of how policy continues to fail children, particularly children of color.
But providers like me, we can do something small but powerful to ensure that our colleagues and our patients have a seat at the table.
We've created the Healthy Democracy Kit to help you do exactly that. The Healthy Democracy Kit consists of a Vote ER lanyard and badge backer that you can make a part of your regular ID cards. The badge backer that you will receive displays a QR code along with a text code that will direct patients to a nonpartisan online voter registration portal that's specific to their state of residence.
In our Vote ER Healthy Democracy work, we have a few core beliefs. We believe that empowered voices in communities lead to positive health outcomes. We believe that by voting for our health, we can preserve what works or demand change for the things that don't. We believe that our healthcare system is stronger when we, as providers and as patients, all show up.
Doctor, what's that badge? This badge allows you to register to vote on your own phone. All you have to do is shoot your phone at this QR code or send this text message to this number, and the platform walks you through all the steps to get registered to vote or request your mail-in ballot in 90 seconds. I gotta go see another patient, but the platform will walk you through the rest. Okay.
Of course I'll register to vote, but who are you voting for?
I'm voting for you and your health.
With all that's going on with COVID, I really want to make sure that you can vote in the safest and healthiest way possible. And the best way to do that would be to vote from home. I can help get your vote from home ballot while you're here at my office today. Every time I feel like it's Groundhog Day, from now on, I'll ask my next patient, are you ready to vote?
As healthcare providers, we cannot tear down these barriers to equity by any one prescription or procedure. We know the limits of our reach. We also know the power of a vote.
Watching all of the drama surrounding this election unfold made clear that we must begin preparing for the November election now.
So vote.
Vote.
Vote like our health depends on it.
Vote like our health depends on it.
Totally great.
Thank
you. Let me see, I'll turn it back to our team.
Can we have the next slide, please? And we'll let you know how to get your freedom kit.
Yeah. Here we are. Okay, ready?
Okay, can you, yeah. So can you just put this in the chat, the link, and then you guys can just link on this and order your lanyards, and they're free. They'll mail them to you, and then there's an easy the instruction sheet of how to use it. So basically, you just you do not register the patient to vote. You give them this QR code, and they go off and do it on their own. So it's nothing that you input. There's no data that you input. You don't register them. They do it on their own phone. So hopefully that'll be easy. And also, there are a couple useful links. If Amanda or Ashley could put the links that I put in the speaker notes on the chat for FAQs and scripts that you may want to use as you're trying to have this discussion with your clients or your patients. Eve Yalom did a lot of work on this Vote ER for the team, and she has some real life experience with this. And Eve, do you want to share your experience?
Yeah, sure. You know, it's a little daunting in the beginning to do this, but once you start get going, you realize it's so much easier than sitting around or knocking on doors to get people voting. And sort of the idea is to get your whole institution involved. And there's like 500 institutions now that are involved doing this, and actually part of the registration project, program is when you sign in, people, I think this is in Kansas, they're doing this, is that, that's part of, registering is like, oh, are you up to date on registering to vote? And then, as you move forward with this, getting other people in the institution involved and, having signs in the registration area. But it's been kind of fun. I have to say, it's kind of fun to say to patients and like figuring out what part of the interview to do it. And people have been pretty responsive. And I think the data shows that if people do go through and register, that about 70% of them actually do vote, which is probably better than any other campaign that's out there. So, and I'm just trying to figure out how, when's the best time in the conversation. I think if you have a new patient, is sort of talking about their, social situation, and just sort of slipping it in there is a really nice way of doing it. But yeah, so
Thank you.
Well, thank you, Eve.
If anybody has any questions, they can certainly email me or Eve about this. And if you want to get started, you don't have to get permission from your institutions. We'd love to get the institutions to buy in on this, but I think you can start as an individual and just do this. So, all right, good luck, everybody.
yeah, I'm
Thank you. I think
happy to talk more.
yeah, we could take one question, Bonnie, and then we'll move on to Humboldt for.
Quickly, I just wanted to say, you know, I am involved with my local League of Women Voters, and I actually gave a climate presentation to them because they've identified climate as one of their major focuses. And I just want to say, I wonder if there's a way that we can partner with them, because that's one of their major things is you know, voting. So anyway, I just want to throw that out there, but we could have a conversation offline if you're interested.
Well, yeah, speaking of which, when's the next Vote for Climate and Health meeting? That might be a good way to bring the conversation forward.
When is it, Cynthia?
You know, I don't know right off. I'm going to try to start putting that in the slides for next time, but we do have one more slide for this section, Ashley. If maybe we can meet to that, and we'll be sure to have that in the newsletter that goes out. There should have been one more slide for voting for climate. Well, let me just say we're working on our Health of Humanity campaign. As an update, we have 500 signers from across the country, someone from every state, which is we're really proud of, and we expect to start getting some social media attention on that once the new Freedom to Vote Act comes out. That was a compromise generated by Joe Manchin and others, including our own Senator Alex Padilla, to replace the For the People Act. We expect that to be introduced sometime in the next couple weeks. There's a lot going on in Congress right now, so the timeline keeps slipping. But when that's introduced, we will send the Healing Democracy video that we created to all 100 senators. And then we'll also have an action alert, a voter voice action alert for individuals to send the video to their own senators. And lastly, we're working on an op-ed with a couple doctors in West Virginia to talk about how important it is to pass democracy reform so that we have an electorate that's responsive to the people, the voters, our patients, to improve climate health.
Awesome.
And that's it.
Awesome work. Thank you, everybody. The team is doing really great work, and this is really inspiring to learn about. I have my badge on still from last year too, so a good reminder.
Know if the badges from last year still work, or do we have to get new kits or no?
I don't think so.
Okay.
You could test yours out.
Yeah, I should test it out. Okay.
Okay, so I'm happy to introduce Dr. Wendy Ring, a family medicine doctor up in Humboldt, and she's going to speak about this really cool game she made to meet a need in her area. So all yours, Wendy.
Great. Well, most of you probably live in places that are a lot more populated, but we're on the far north coast, and our our biggest town has got less than 30,000 people in it. So we're a bunch of small communities that don't always agree with each other. And NIMBYism is alive and well here. Everybody's for climate action until it might have some personal impact on them. And then suddenly it's another story, whether it's, the fishermen and the offshore wind, or somebody who's going to have a, solar farm in their over the fence. All of a sudden it's a different story. And the issue is that what people have to lose looms a lot larger in their mind than what we can gain or what it is that we're trying to avert. So that was one of the things that we were kind of struggling with as climate activists up here. The other is that none of us really have a very good sense of scale about how much greenhouse gas emissions we really need to reduce by 2030 and what it would actually take to do that. So it would be really common where someone would show up at a meeting and say, well, I don't like this project, but why don't we just put solar panels on everyone's roof and that'll solve it. So we wanted to try to give people that sort of perspective. And we also have a county climate action plan in progress. And it was, can you change slide for me? And this is one little piece of a spreadsheet of what goes into the climate action plan. It's made by a bunch of engineers and planning staff. It's totally citizen unfriendly. And what you get at the end is a product that, you know, essentially people say, oh, you're either for it or against it. But what if it's a bad plan, which actually it at least started out to be a bad plan? You know, how do we get citizens involved in that? So I thought, can you change slide, please? Wouldn't it be great if we could do something to kind of make the quantitative aspect visual and tactile, so people could hold it in their hands and they could sit around a table and talk to each other about it. I also know from my own experience with trying to talk to people about climate that, you know, we could take ourselves too seriously, and sometimes it's good to make things fun. And we definitely need to emphasize the benefits that people are going to get and not just the harms. I mean, we know from our experience in medicine, you can't scare people into doing the right thing. So we have to show them what's in it for them. So I made this game. It's called Evergreen. And the way that it starts, let me just back up there for a minute. It starts where we sit people around a table and we say to them, a global climate summit just ended in failure. And despite scientists' plea to cut greenhouse gas emissions in half by 2030, world leaders leave without a plan. But before going home, they get drunk in a bar and throw a dart at a map of the world, pledging that every nation will cut emissions as much as the place where it lands. And the dart hits Humboldt County. So you are the team appointed by your fellow citizens to choose the climate actions that Humboldt will take and to save the world. So, and the players start out with a collection of these cards. And you can switch to the next here that have various solutions on them that are all scaled to our local area. And next slide. And the cards are sized by how much greenhouse gas emissions that they would reduce. And this is a great example of something that I uncovered while doing the research for this. This is about heat pumps. And we have far more gas furnaces than heat pumps in our county, but replacing the heat pumps, replacing our wood stoves with heat pumps gives us a much bigger greenhouse gas reduction than if we replace all those gas furnaces with heat pumps. I mean, who knew, right? So, and each of these cards has a price tag on the front, and then next slide, and the savings on the back. If you turn the heat pump card over, you would also see that there were huge health savings from the wood stoves, much bigger than what you would see if you were doing the gas furnaces. So it's good to get this sense of relativity, you know, how things compare with each other. So to make the game more challenging and inject some reality, there's a time pressure. There's 4 timed rounds of 5 minutes each. There's social pressure because we make people come to consensus. They can't adopt a solution until everyone agrees. And then there's financial pressure. They start out with some seed money, but not enough to complete their mission. And at the end of every round, they get a climate impact. Next slide. So, and these are all, you know, based on local projections of what's going to happen. And I started making this game 2 years ago, and unfortunately, a lot of these things are already happened. It's not, I was looking at what might happen in 10 years, and, you know, here we are. So it sounds like, you know, it would be almost impossible to win this game, but the health savings and the other savings from the solutions really make it possible. So I wanted to just show you, I made a little video of people playing the game. You can,
Amanda, would you be able to help with the video part? Wendy, this is so cool. I love it. I
Yes.
could try. I don't know if the audio will work.
I can do it. I can
Okay.
pop it up. Hold on.
Okay. This is so cool. I want to play this, Wendy.
It's really fun. It's really fun, and it really works.
Wow. Yeah, we need this in so many spheres.
Wendy, the only thing is I don't have it doesn't look like the video is embedded in the PowerPoint. Is there a link to the video you can send me?
I could put it in the chat, I think. Yeah. Let's escape. We need some tech support up in here.
Yeah. Oh,
hi, I think it's great, your tech.
Okay, I got it.
Do you have it?
Yeah. I
Okay.
think I got it.
Thank you all for your patience and
Sorry,
acceptance.
I thought I did that right, but
No, I think
No,
you
we're there.
did.
It takes a team.
Mine is a Mediterranean diet.
Oh, I'm into that.
It's also pretty big.
Yeah,
Like,
yeah. I say we do this.
Okay.
I assume it's going to be voluntary. We can't force people.
Well, this is
to...
everybody in the county cuts their red meat consumption down to twice
definitely
a month.
be controversial.
But some people can have none, and then the other people can have more. But
Oh, yeah, you could sell offsets. Like
meat credits. $288 million.
Seriously?
Yeah. Replace 90% of PG&E plant with a big number megawatts of clean energy and storage. It costs $40 million, and it's a chunky guy.
Yeah.
Okay.
Let's do this.
Yeah.
Yes?
Yeah.
I am in agreement.
Let's
Yeah,
do
yeah.
this.
These yellow ones seem.
Too Rising seas and groundwater infiltrate Eureka's sewer pipes. Sewage backflows into city streets and the bay. The wastewater system must be upgraded. Cost $130 million.
Oh, wow.
That's telling people they can't live outside of like the inner core of the town.
That's a little tough.
That's
but, you know,
hard to tell people.
We don't really have a lot of options.
Yeah. Which I guess is eventually how it's going to go with humanity. It's like, it sucks to tell you you can't do these things, but if you don't, we'll all die. So can you please build your house over here? Because we're out of money and climate is creeping up on us.
You might have earned some. Flip it over.
Whoa, gnarly.
That puts us back in the positive.
Walking or biking short distances saves $57 million in health costs, which is crazy because it costs $58 million.
Wow.
Awesome. Well,
I was surprised at how, I mean, it wasn't easy, but it was like manageable. The hardest part was figuring out how we would convince people to do things. And obviously that's not an easy feat, but climate change has been such an existential threat, and this really nicely lays out things that are really concrete, and that was surprising to me. I thought we were going to lose, basically.
we did all this stuff and actually saved/made money. We've still got money to fight another day. When that next climate crisis comes, be ready.
We have $69 million for the next climate crisis.
I think something. Sorry. Yeah. So there's more slides. There's a couple more slides there.
Oh, Ashley, can you go back to Sharon?
So I just wanted to show you
a
little bit about how you get those numbers, because I mean, I think that's the important thing that I learned is you know, how do you figure this stuff out? Because
Mine is a Mediterranean diet.
Oops.
Sorry.
Go to the next slide. Yeah.
Okay.
Yeah. So because these are things that we can use as advocates, you know, nobody else is going to walk into a meeting and say, well, if we shut down this power plant, it's going to decrease particulates by this much, and we're going to save these many lives and this much money. But that information is actually available. So this is just an example of, you know, how to figure out what the health impact is of closing a power plant or a refinery or whatever. There's a carb mapping tool, and you go find the facility, and it shows you the emissions. I'm sorry, you can't really see these slides very well, but it's telling you, you know, the particulates and the VOCs and all that. And then next slide. And then the EPA has an online kind of calculator where you go in and you enter your location and you enter what those emissions reductions are, and it gives you, just pops the information right out. So next one. And then there's this also, we have a really wonderful model for transportation policy, where you can go in and create scenarios and pick your county, and it will tell you the health benefits. So this is really useful information. And this is some researchers at UCLA School of Public Health figured out what the health benefits would be if we electrified all of our buildings, and they have it by county and by air basin. Cool. So it is important to understand that some of the big bucks in these things are not real numbers in the way that you and I would think of them. They come from something called the value of a statistical life. And those aren't even really lives. They're kind of compilations of lots of small risk reductions added together that are valued by how much people would be willing to pay to reduce their risk of dying by a certain percent. So it's not actual health dollars that we could use for something else, I guess is what I'm trying to say. But that's how mortality is valued when health benefits are monetized. That's how all of the policy folks do it. And so if we want to have them, comparing apples to apples, and we're talking about policy, then we sort of need to use those numbers. So
Wendy, just a 2-minute
okay.
warning.
Yep, that's it. We're about there. So Evergreen is a great education tool. You can download all the stuff to play. If you go to that to the coolsolutions.org site, and I encourage you to do it. I think it's useful for people who live anywhere, even if you don't have composting cow manure as one of your climate solutions.
I love it.
So yeah,
cool.
Let's have some fun.
Woohoo! A huge round of applause. I really loved the scripts of the people talking about the game, because it just rings so true to all the conversations we're having. We have time for a couple questions if anybody has one.
Wendy, oh no, Megan, you have your hand up. Go ahead.
Yeah, I was wondering, does this apply across all the counties in California? Or like you look for a power plant, is it going to show you a power plant in Sacramento versus Humboldt County?
Yeah. Any facility, any stationary major emitter, they all have to report.
Plastic.
Yeah.
We're supposed to close a couple, and that is yet to be seen. So I would love to see how this game affects that.
Mm-hmm. You could request a board meeting and then bring the game.
The thing in the game is for closing our power plants. So you would have to go and like I showed you, and get that information, go on the CARB mapping site and find your facility, and then take those emissions and enter them into the COBRA. If you need help doing it, I'm happy to help you with it. It's actually really simple, a lot simpler than I thought it would be.
Yeah, and we'll definitely include the resources that Amanda's putting in the chat in our newsletter, because this is something that I think we can all really bring to our local, climate action conversation. So thank you so much, Wendy. It's really inspiring, and you definitely highlighted the CHN norm of humor, because this is really, really a fun way to frame it. And it just strikes me that so much of what we as clinicians are doing is translating science, and this is such a cool way to do that. So huge round of applause. Thank you. And then now we're going to let's see, Amanda, I can share. But we're going to turn over to our sustainable energy team. So I can screen share. So Karina, do you want to share?
Yeah. And I just wanted to add that, Wendy, I think you win a star for being one of the most creative people. And I also think it's so valuable to make something practical and real, because for so many people, the whole climate change thing seems like so out of their own reach. So I think, yeah, super impressive. So just quickly, I'll be brief. Some of the things to get you up to speed on what the sustainable energy team has been up to, our main things, we're still waiting for the CalGEM rulemaking, public health rulemaking for oil and gas wells, still not released. When it is, we'll have a 60-day comment period. We have been keeping in touch with the Vision Allies Coalition. The main demand is to call for setbacks, that is halting the issuance of permits within 2,500 feet. And from their last meeting this past Thursday, they want to see the public health report that's being used for these rules to be released. Those are being kept undercover. So Vision sent a letter to CalGEM last Friday, and some other groups, California Natural Resources Agency, Department of Conservation. to demand the release of the public health and safety report that the rules will be based upon. This so exciting yesterday. I think we should share. I'm going to put it on Slack, but Kobe from Vision released a new study, sent an email about a new study that was just released by Seth Shankoff and David Gonzalez that shows, I think it's the first of its kind, that correlates from air quality monitors for PM and ozone and all the important air pollutants from and relates that to the proximity of oil and gas wells and how and with the wind. So it's so interesting and correlates how close the monitors are to oil and gas wells and their production rate, and shows a direct correlation. Super interesting. Anyway, so November 19th is going to be a week of action because it marks 2 years since the Newsom administration released the directive to CalGEM for the draft rules. So there's going to be public actions planned for November 19, no matter if the draft rules are released or not. So that's CalGEM, and then the sustainable energy team members have been super busy most of the year writing letters, submitting comments on various bills that would affect California energy. Some of our efforts have borne fruit, such as the ban of gas-powered small engines just signed by Governor Newsom this weekend, gas and oil well remediation. Some of these have been a bit watered down, but they're still something. And then credit for renewable energy generation on First Nation lands. We've also written letters to CARB, the California Air Resources Board, about the scoping plan, to the Bureau of Land Management before their review of the federal coal leasing program. And then now we're in the process of creating a list of the sorts of policies we would like to see implemented, so we can use that as a guide when influencing legislators about what kind of bills we'd like to see authored, written, sponsored in 2022. So that's what we're working on now. Our next meeting is Monday, October 18th at 5:30 p.m. We'll put that in the chat, and that is it.
Woohoo! Awesome work, everybody. And great, so there's the link if you want to come to the chat next Monday. And we're running a little bit behind, but we're really excited to highlight 2 of our Fresno members. So Race, if you want to share about your recent experience, and is it okay if I give you a 2-minute warning, 5 minutes in?
Yeah, sure.
Okay.
How's everybody doing? Good morning, everybody. I'm Ray Spora. I'm an ER physician and a toxicologist, and more recently, I've been involved in public health. And I guess the story that I have to share is about an episode that I experienced about a month ago, related to doing some advocacy around the infrastructure bill, the Build Back Better Act, or that legislation. So I'm the interim health officer at the Fresno County Department of Public Health, and I wear these other hats as well. But a lobbying group approached me. I forgot the name of the lobbying group, and they said, we're putting together a panel, and we'd like to talk about public health and climate change. And that's kind of how it was kind of described to me. So I was like, oh yeah, sure, I would love to talk about that. I'm very interested in this topic. I think that it's a very important conversation to have. And the panel was, we went through like the rehearsal, and the panel was like myself, somebody from the air quality board or something like that. I forgot exactly what agency, but it was something about air pollution. And then basically someone representing the farmer and agricultural network, which was just dedicated to farmers that are kind of uniting around climate change and making changes related to that.
Strawberry acai and a spinach feta wrap.
Oh,
alrighty, a strawberry acai with ice. Alrighty, a trench of strawberry acai. Was that with lemonade or without, Brio? With. Alrighty, a trench of strawberry.
Okay.
Oh, no problem.
Sorry
And
about
so that no problem. So that was the panel, and I was like, oh, sure, this sounds great. And so I just basically did it right here on my back patio. It was basically a 3-minute talk. That was my part of the panel. And during my 3 minutes, I basically just read from a grant proposal that we had worked on. I didn't even spend that much time doing my homework, which I think is one of the lessons learned. But I basically just read from this grant that we had written up about global warming and how to support climate resilience in Fresno. And it basically just said, the Central California counties are very vulnerable. And we have very vulnerable populations. And then I just closed it with, and I support the Build Back Better plan, and our congressman should support the infrastructure bill. That's it. That's all I said. I thought it went pretty well. I was like, okay, I do a lot of media just through my work, so I didn't really think too much of it. That was Friday morning. Then later that afternoon, I got a call from my kind of supervisor at the county who said, whatever you did this morning, now it's in the paper and people are not happy about it. And I was like, okay, which people, like what part of it are people not happy about? And he wouldn't disclose any details. And I think he was just trying to gather information too. And I was like, well, did you actually even see the speech that I gave? He's like, no, I haven't seen it. I'm like, well, why don't you do that as a first step and just go watch it yourself and see what you think. And then call me back, or better yet, connect me with the people that aren't happy so that I can talk to them directly. And so then that was Friday afternoon. And then all weekend I heard nothing. And then on Monday, they were like, we need to set up an emergency meeting with you. And so that's what they did. And these are like my county supervisors. And basically, they then proceeded to just like yell at me for like an hour. And they were like, you were way out of line. You basically should never have done that. You got misled. Maybe you're just exhausted from the COVID surge, which is true. I was very exhausted. And why don't you just take a couple of weeks off and also not show your face and talk about this ever again? So I was like, okay, well, I think you're overreacting. But and they said, oh, and we also want a public apology for you making that speech. So I was like, well, I don't know how much of this to process. I think, you're overreacting to my 3-minute speech, which was really not very controversial at all. But then I thought about it for the rest of the week. It was quite an awkward week. And in the meantime, we had like a state of the county breakfast, which was at the zoo. It was outdoors. And it was like, basically the AQI was probably like 250. And everybody's like, oh, isn't this so great? We're at the zoo, we're outdoors. And I'm like, are you guys kidding me? Like, we're all smelling wildfire smoke and we're doing the state of the county breakfast. And it was supported by Chevron, by the way. That's who sponsored it. So then like that Friday, when I did my regular media, I basically just took 2 minutes because they insisted on a public apology. And so I took 2 minutes to kind of just say, hey, last Friday I gave a talk. I talked about the public health impacts of climate change and the threats that it represents to the Central Valley, including our vulnerable populations. I should have ended my commentary there, but I basically weaved into the territory of legislative advocacy, which is not my role or my responsibility. So then I just did a very, very kind of pat apology. And I was like, well, that's what they demanded. But then that became the story. So this first, the first talk that I gave just kind of died. Like nobody heard about it. Nobody cared. But then because I gave the apology, now that became the story. Like, oh, what's going on? Why is the health officer having to apologize to these conservative leaders of our county, et cetera? And ever since then, I've been receiving emails just kind of encouraging me and just saying, we thank you for standing up for this very important issue. It's been very instructive. So the actual crime that I committed was that apparently legislative advocacy is a very technical issue, and it's like a buzzword whenever you have an official role like I do. And it's really something that has to be vetted very carefully. There's actually like a binder full of topics that you know are the official positions of the county. And I'm sure like every organization has this that does legislative advocacy. And then obviously the people that are supposed to speak about pending legislation are, you know, professionals, whether you call them lobbyists or advocates or whatnot. And it shouldn't be anyone else speaking about these issues. I had no idea. I had no idea that this is how things go in government, because as an academic, whenever I'm asked to speak my mind, that's what I feel free doing. And like, I don't have to check that out with anyone. And honestly, this is not controversial at all. Like the content of what I said was not controversial at all, except that I advocated for the infrastructure bill. And I think that, you know, the very conservative forces in the Central Valley are really anti. And so I think that that really triggered them. But even beyond that, even if they had supported the legislation, even if it was something that they were really pro, it would have still been wrong for me to say, hey, you know, this legislation should pass, because that's just how the game is played. So that's my story. I mean, I'm still obviously reflecting on this. I still am receiving a lot of emails from people in the medical field and also outside the medical field here in Fresno, who are basically just very motivated. So that kind of is very kind of reassuring. I don't know where to go next. You know, the whole reason that I am part of this group and the whole reason that I got to know Ashley and Amanda and all of you is because I wanted to start something called C6, which stands for Central California Climate Change Clinical Collaboration. And that's basically bringing together all of the clinicians in the Central Valley to say, hey, this is going to be a big challenge for us as clinicians. We already are like super under-resourced. We don't have enough hospitals. We don't have enough doctors. We don't have enough nurses. And now with the health impacts of climate change, everything's going to become even more strained. And we need to get smart about prevention and mitigation and resilience. Mm-hmm. So that's the reason that I wanted to create this C6 collaboration. You know, I don't know where that's going to go now, because I feel like in some ways I made my job harder because I basically have to ask permission for every step that I take as the health officer from the county board of supervisors. And I didn't realize that, you know, this was a hot button issue. I really didn't think they cared that much. And in any case, we're trying to help the people, you know, so it's like, you would think that I would be more supported, but it's been very instructive. I know I'm running out of time, so I just wanted to share that and just see if anybody else has had any similar experiences or what suggestions about, you know, next steps you would suggest.
Mm-hmm. Thank you so much for sharing. I think, yeah, I can relate being part of a different institution, KP, and being kind of you know, the gag rule situation.
Okay.
Amanda, do you want to ask a question?
Oh, my question, Riz, thank you for sharing that and for what you did and all of it. And I know I don't know you very well, but I've been thinking about you a lot.
Oh, thank you.
Over the last few weeks. Do you think that is your sense that if you hadn't said anything specifically about the Build Back Better, the budget reconciliation stuff, do you think that this would have been an issue, or do you?
Yeah. So I asked them that, and they said next time you want to do something like this, just say that you're speaking as a private citizen and not on behalf of the county. Even though I did it on my own time in my own backyard, the way that it was labeled is like, oh, here's the Fresno County Health Officer speaking about this. And they said next time you can voice whatever you want, but you need to do it as a private citizen and make that disclaimer. So that's one thing. The other thing is, because we were just so inundated with COVID stuff, I really didn't do my homework to like give people a heads up. And so I didn't really have that, you know, it's like, you really should have your team kind of vet these sorts of opportunities, especially if you work in an organization where there's these rules. Apparently there's rules. I didn't know at the time, but you know, I should have had more conversations with my team and with my supervisors to say, hey, I'm going to be discussing this, and then really set the ground rules about what was allowed and what wasn't allowed. And to me, that would have gone much smoother. So, because I say stuff all the time that they may or may not necessarily agree with, but they understand where I'm coming from and my rationale. And so they've given me a lot of leeway to talk about COVID, even though they're not necessarily pro-masking or pro-vaccine or pro-public health about a lot of measures. But they allow public health to say that kind of stuff because they understand that we're not gonna all be on the same page when it comes to COVID. I think this just came so from left field that they were just taken aback that I even had a position on climate. I know everybody's rolling their eyes, but this is just such a new issue that they were like, oh my God, we can't believe you talked about this. I'm like, okay, well, now I know, so.
Yeah, but we really want to continue the conversation about how to support you and more health professionals speaking out, whether individually or
I think I'm frankly, I don't know if anybody else is in the public health field here, and this is a big discussion, but I really think we need to have the California Department of Public Health step up. I mean, they basically need to be talking about climate at a much greater volume. And I understand COVID is important, but it's not the only epidemic affecting Californians. And I think climate is going to be as impactful or more impactful than COVID has been. And it's time for CDPH to really step up so that health officers don't have to be the lone voice. And this needs to be a statewide conversation. And if we can't do it in California, then imagine some poor guy in Alabama or Mississippi who's trying to do the same thing, or gal. It's like California needs to lead the way about this conversation. And I'm just astounded that we're not having louder conversations about this. So kudos to all of you for doing all you're doing and educating our colleagues.
Yeah. In the interest of time, which I think we need to schedule a whole meeting to talk about that. But we're gonna wrap this part up and then turn to Morgan sharing her experience. So Bonnie and then Cynthia, if you want to ask your questions.
Yeah, I just, first of all, I want to thank you for that story. And I do want to say that's what I thought is if you really make it very clear that you're speaking as an individual. But, I know that in our county, we've had such an issue with our own health officer being kind of beholden to the Board of Supervisors.
It's crazy. It's like that in every county.
I know.
So crazy.
And but he's kind of on their side too. So he's not doing, in my opinion, the best thing in terms of COVID because he is beholden to them. But on the other hand, I wanted to talk, there is a book called Premonition. Have you read it?
Yeah, Michael Lewis. Yeah.
So that has a lot of similarities to climate. So if you apply a lot of what they talked about in that book, it's about the public health department in California and the health officers around COVID. There's a lot of parallels between COVID and climate, I think, in that book.
That's a great point. I'm going to read that book. I've got it. I just haven't opened it yet, but I'm going to read it with that lens.
Read it. Thank you.
Yeah, thank you. Yeah, no, that's a great insight. Thank you.
And then Cynthia.
I thank you so much, Race. And we've had the same kind of issue with one of our voting team members feeling like, oh, I want to work on this, but I work for public health, so I can't speak out. And it's ironic because the people who are the most knowledgeable, who should be the most trusted, are muzzled by this. So we really need to figure out how we can do it. And I don't know if just saying I'm speaking privately works. That sounds great. Another thing that we've done frequently is try to look at 501c3 versus 501c4 guidelines and say, I wonder if that would work. And just saying, this is like you're saying, this is an epidemic that's going to be worse than COVID, and we're going to need things like these provisions without mentioning the specific legislation. I wonder if that would have gotten you far enough behind and let someone else then mention the specific legislation. But that requires a little coordination and planning, like who's going to deliver which message.
Totally. Yeah, no, coordination and planning, those are the key words. And I think that especially with sensitive topics like this in very conservative areas, you really do have to put in that extra effort just in case.
But Race, we are with you, and we're committed to continuing this conversation about how to ungag
Thank you.
science and climate. So to be continued. And then Morgan, if we're glad you're here as a new member. So we'd love to hear a few minutes, because we are running a little behind, about your experience with the meeting with Banta, and if you want, or sorry, with Costa, and if you want to introduce yourself, that'd be great.
Okay, hi everyone. So my name is Morgan Thies. If you can see me, you probably can tell I'm on maternity leave. So sorry if you hear a little bit of baby sounds in the background. So I'm a family medicine physician. I actually work full-time at Planned Parenthood doing primary care in Fresno, and also reproductive health here in Merced. I actually live in Merced, which is about an hour north of Fresno. I'm hoping to meet Race, who just spoke. Sorry if I mispronounced your name. And wow, what a story. I have sort of a more straightforward, just kind of entry into doing some advocacy here that I'd like to share. So I, just had my second baby, and I was reflecting while breastfeeding in the middle of the night that, climate change is just such a big issue, and I just feel like there needs to be so much more attention on it so that we can work on it and fix it. And also, one of the reasons I got a medical degree was in hopes that that degree would give my voice some power in advocating for things that need to change in the world. And so I got an email from Joel Charles, who, thank you, I went to residency with, who's doing a lot of climate advocacy out of Wisconsin. And he said, is anyone in these districts that might be able to advocate for the infrastructure bill and budget reconciliation? Because I think this is like a big opportunity we don't want to miss. And I just reached out and said, I live in Costa's district, and I haven't really gotten involved in anything because I've been a busy working mom, but I'd like to. And so he was like, let me connect you with your old classmate from Stanford, Amanda Milstein. And I was like, oh my gosh, that would be amazing. And I didn't even know that, she had started this amazing group. And so we connected, and I've been, sleep deprived and not having a whole lot of extra bandwidth. So I was pretty nervous about having a legislative meeting, and, my OCD personality was like, I'm not going to have time to prep this to the level I want. I don't know all the climate stats. I know enough to know it's a huge problem, but I'm like totally green. So I talked to Amanda, and she was like, listen, we can support you. They had like all of these really helpful, just like quick guides with some very helpful statistics. We set up a meeting. We were hoping to have 2 more healthcare professionals, but it ended up just being me and Cynthia and Amanda. And I hope you guys don't mind I'm using your first names, but they're physicians as well. And so I was like a little intimidated going into it. And when the meeting started on Zoom, of course, it was not only Jim Costa, our representative, was there, but like, I think it was 4 of his aides were there too. So there was like quite a lot of faces and ears listening. The nice thing was all I really had to do was prepare a patient story. So I shared about a patient I had who was kind of dealing with obesity and dealing with asthma, and like his mom asked me, what should I do? Should I send my kid out on bike rides in the terrible air and risk a terrible asthma attack, or should I, risk him having like fatty liver disease that could progress? And this is kind of an impossible choice, But then Cynthia and Amanda were there to kind of like introduce things and kind of keep things moving and structure things. And I just felt like so well supported. But yet I was able to just have that power of presence as the constituent and a healthcare professional who's actually caring for people in this area. So I found it really gratifying. I still have a lot of climate anxiety, but I'm very, very excited and feel so much more inspired now to be hooked up with all of you, who hopefully I'll actually meet some people in person one day. And yeah, it was a really positive experience. It's made me excited. It was actually, a lot less intimidating by the end. Jim Costa is, a regular person. His job is to do the work of his constituents. He seems to really respect respect, you know, healthcare professionals. And yeah, and I like the idea of like starting to collaborate. So I've learned a lot in the last couple of weeks just getting involved, and I really hope to keep working with all of you guys.
Oh, we're so glad that you are joining, and yeah, huge kudos for, you know, jumping out of your comfort zone, which I think we're all learning how to do. You know, we have to get uncomfortable to change the status quo, which is at odds with the safety of all those we love. So really appreciate your courage, and everybody's courage. You know, we're all kind of wading into territory that we don't have, we're not the experts, but the experts need help. So we are leveraging that respect and that social influence that you spoke so well and clearly about, Morgan. So really awesome. And this is, you know, the reason we really wanted to highlight Morgan's courage and stepping into this is because this is what we're all about, is helping each other become those local leaders with our legislative officials, whether it's our state, you know, assembly members or our federal ones, but really bringing our voices into their offices and leveraging it to, you know, compel them, to pressure them to have bold action policies for climate. So, yep, learning together, and really, really nice to meet you, and your baby is adorable. So we're gonna wrap. We're gonna wrap up by just reminding everybody how new people can join CHN. We actually we're just over 2 years old, and we also just crossed the 500 member mark. So our vision is that all health professionals in California are involved in climate, whatever group. But if they want to join Climate Health Now, we welcome all health professionals. So the way to join, you can just visit our website, and now we have this really cool join us pop up thanks to one of our members. But you can also email at caclimatehealthnow@gmail. And if you want to introduce a friend, just send an email and CC them and say, you know, their name, kind of what they do professionally, where they live, and then if possible, their phone number. So please invite all your friends who are health professionals or students. And then our next meeting will be back at the 12 o'clock hour on November 10th, which is right around Veterans Day. So just look out for a really awesome newsletter that Amanda has curated for us, and really appreciate everybody joining. So thank you. Have a great day. Bye, everybody.
Thank you. Thanks so
Thank
much.
you.
Great.
Can I take a screenshot real quick? Can everybody
Sure.
smile? Okay. 1, 2, 3.
October. Woo woo.
Awesome.
Halloween.
Bye.
Morgan, thank you for joining, and to Hazel for cooperating.
So great.
Don't we thank the baby?
We thank the baby.
Thank all the babies that have activated so many people.
Absolutely.
That's true.
Waking us up. All right. Take care.
Bye, everyone.
Bye, everyone.